Hi, I'm Steve Adubato. That's right, we are at MetLife Stadium for the Celebrating Life and Liberty event. You can hear the music playing in just about an hour or so. There will be about 6,000 people here. We're honored to be talking to Robert Garrett. Bob Garrett is CEO. So we're actually going to be doing a half-hour special on this event, talking to survivors, family members, clinicians, others who are part of this event. But right now we want to talk to Bob about some important healthcare issues. So if I say to you, trends in healthcare, big picture, you say?
Big picture, I'd say first and foremost, I'd say that consolidation in the healthcare industry continues to accelerate. Mergers, acquisitions, affiliations, partnerships. We've seen a lot of it. We're going to continue to see that happen. I think it's actually not a bad thing. I think it's actually a very, very good thing, because when health systems can consolidate and can merge, you can share best practices. So clinical care can improve. You can also not duplicate services and reach some efficiencies and some synergies. So hopefully healthcare becomes more affordable, more accessible. You get to a certain size and scale that you're able to reinvest in the communities that we serve. So those trends are going to continue to happen. I think the market just continues to change. It's going to be really hard for the old-time community hospital, the freestanding community hospital, to really be able to survive without at least an affiliation, at least a partnership, if not.
You need scale.
Yeah, you need the scale to really survive. The other big trend that I see, Steve, is healthcare. We know that more and more healthcare is being provided outside of the four walls of the hospital. So, you see more ambulatory care popping up, whether it's retail healthcare centers, surgery centers, fitness and wellness centers. But now the big trend is really toward home care.
Home care.
Yes, and the future of healthcare is really healthcare being delivered in the home with the right technology. And that's really going to be key, because, and it's almost like what goes around comes around. I mean, if you think about back in the Middle Ages, that's where healthcare was really being delivered, in the home. It's going back to the home, but this time it's going to be with technology. So.
Well, hold on, Bob. I'm curious about this. The technology part of it.
Yes.
We talk about innovation a lot. Actually, check out our website. You'll see an entire series we're doing on innovation. With the innovation, with the technology, but go back. Doctors or physicians would come to your house, we'd think the old school bag, right? You and I are too young to remember that. But in all seriousness, the technology with physicians and clinicians, how do you keep the human connection?
So it's going to be through a virtual connection. So through your smartphone, where you can receive health information, you can actually get physician consults through telehealth, through telemedicine. That's really going to be where the connection is. And where it's actually already happening, patient satisfaction is actually improving, because physicians and other providers are spending more quality time with patients, as opposed to being rushed in a crowded office where you have office hours, a certain number of minutes, a certain number of hours, and there's a big backup, and the physicians they want to spend more time with their patients, but they really can't, because they got an office full of people. This way they can really schedule these so-called virtual home visits at different times during the day. We're seeing actually where it's happening now, patient experience is actually improving. Kaiser Permanente out on the West Coast in California, almost half of all of their visits now, their physician-patient visits, are done through telehealth and telemedicine.
Not face-to-face?
Not face-to-face.
And patients, many are saying, we're good with this?
We're good with this, yeah. And even in the hospital, so good examples are we have shortages in certain specialties, like in psychiatry. So if a patient needs a psychiatric consultation...
Excuse me, but telepsychiatry?
Telepsychiatry. So in community hospitals, in communities where psychiatrists are in short supply, a patient can, on a timely basis, get a psychiatric consultation while they're in the hospital, because they might wait otherwise a day, 2 days, or 3 days for that psychiatric consultation. Much more efficient, much better for the patients if they get it on a timely basis. The other thing that's happening, and we're just opening for the first time a behavioral health urgent care center. And through behavioral health urgent care, patients will be able to get telepsychiatry visits in that setting as well. So instead of patients having to go into a crowded emergency department, wait for sometimes hours, if not days, for psychiatric consultation, they can get almost an instantaneous consultation in a behavioral health urgent care center. First one opening in September in Neptune, New Jersey.
Innovation is not a choice. It's something that goes on a regular basis, has to happen, particularly responding to patient demands and needs. The other thing is, I want to talk a little bit about, Bob and I have talked about leadership a lot, and to fully disclose, I do leadership and communication coaching within the network, and also your network is one of the big supporters of what we're doing in public broadcasting. But I'm curious about this. Mergers, you started talking about that.
I did.
Hackensack Meridian. How many years in now?
We're 3 years in.
Okay, if I said to you, number one lesson you've learned and that others should learn or could learn from the merger, you say is?
I'd say the number one lesson is focus on integration, particularly cultural integration.
What do you mean integration?
So here's what I mean is you can have a merger and yet these hospitals can still be independent entities, almost like a confederation of hospitals, very loose. Or you can have a highly integrated system where you do share those best practices and clinical care improves, or you put all the health records on one electronic health record system.
Easier said than done.
It's easier said than done. It's hard work, but the integration pays off because if you're really going to get the benefits of being a healthcare system or a healthcare network, you have to integrate. And you can have the best strategies in the world, but if you don't have a unified culture that's strong and united and everybody's aligned in the same way, guess what? Those strategies are not going to survive. You're not going to be successful. So getting one culture when you have 35,000 team members and 8,500 providers is not an easy task. You got to work at it constantly. So the lesson learned is, you can't integrate too much. You can't focus on culture too much. Not that strategy is easy to either develop or execute.
But culture?
But culture is what's going to sustain you.
Everything could look fine on paper.
Right.
Right? The numbers look right, economies of scale, we can save money, we can provide better patient care. But if you don't come together as human beings and work together, it doesn't work, no matter what the numbers look like.
That's absolutely right. It's it's kind of an old adage about it's about people, right? And people aren't aligned if they don't have the same focus, the same mission, the same vision, the same values. And we redid everything at Hackensack Meridian. We wanted to give our mission a fresh look, a fresh way of people identifying with it. We have a new vision. We have some core values, and we do various events in person, virtually, to really get our team members really align with that mission, vision, values.
Communicating not easy with that many people.
Not that easy. So, Steve, one of the things that we do is, in addition to rounding, in addition to a lot of events I do in person, like the event here at MetLife Stadium, we do have virtual town hall meetings as well. So we do them like 3 or 4 times a year, and we show them to team members all around the network at their convenience, not at our convenience, because they're, our physicians, our nurses, our technicians are working hard every day, and we want to make sure that when they're ready to hear the message, we can deliver it, and you can do that virtually. It doesn't take the place of being there in person, but it's a great method when you have 35,000 team members at 500 different locations.
For those of you watching State of Affairs, you're used to seeing us in the studio. We're out here on location. This is the Celebrating Life and Liberty event here at MetLife Stadium, and we appreciate you joining us.
Thanks, Steve. Thanks for having me.
State of Affairs with Steve Adubato is a production of the Caucus Educational Corporation, celebrating over 30 years of broadcast excellence. Funding for this edition of State of Affairs with Steve Adubato has been provided by NJIT, New Jersey Sharing Network, the New Jersey Education Association, the law firm of Gibbons, P.C., PSC&G, the North Ward Center, and by Adler Aphasia Center. Promotional support provided by New Jersey Globe and AM 970 The Answer.